Now I'd like to introduce the Roper Hyperbaric Medicine Facility to you. Roper Hospital, Roper Main Hospital, is downtown Charleston on Calhoun Street, about a mile or two away from the South Carolina Aquarium and the wharf there. The Roper Hyperbaric Medicine Facility has been in existence in one form or the other since the late 1980s. I've been the medical director since 2004. When I came on board, we were a small two-chamber facility in the back room of the emergency department, but in the last few years we've grown. We've added a third chamber, we've modernized our chambers, and we have a much nicer, larger space in the new heart and vascular tower at Roper Hospital. This is where we see patients, render treatments, do evaluations. We also have the wound center, which has moved from St. Francis Hospital to Roper Hospital, which is nearby, and I also see patients there. The Hyperbaric Medicine Facility is open from about 7:30 in the morning till about 3:30 in the afternoon, maybe 4, depending on our patient load, where we're actually staffed with nurses and physicians, but we are on call 24/7, 365. As a diver, that means that you've got emergency coverage for arterial gas embolism, decompression sickness. We also treat patients with carbon monoxide poisoning and various other emergencies, and we maintain a very vigilant call schedule with a doctor and nurse always on call. Also the respiratory therapists here at Roper, who are always in-house, and the other emergency and critical care services work together to provide that safety net of critical care capability. All of the chambers, you can probably see behind me, one of our chambers of 3 have the capacity to provide IV therapy during a patient's treatment, and this chamber behind me is actually equipped with a ventilator so that if a patient were unconscious, very badly stricken after a dive, maybe an arterial gas embolism, something very serious, we could actually render the necessary hyperbaric treatment while the patient is unconscious and not even breathing on their own. Also, carbon monoxide victims with severe intoxication who aren't able to support their own airway will sometimes get intubated, and we'll treat those patients. Our staff is very well versed and well trained in treating these patients. Our unit is accredited with distinction as a level 1 facility from the Undersea and Hyperbaric Medicine Society, which means that we underwent a rigorous 2-day evaluation and was found to be among the best of the best, and we're very proud of that. And as a diver, you should feel very confident that should something unfortunate happen underwater, despite best planning, that you will be in good hands, and we will give you the very best chance to improve your outcome and hopefully bring you back to 100% health. With that, please know that subsequent video to this, I will go into depth about how to recognize dive-related emergency or elective problem, how to seek care from us using either the emergency system or the on-call system, where you would speak to us and we would triage that for you. And that video will be very important, so I'll stop here and just remind you, when you get to that, please watch and listen. There's written documentation also to support that. You'll see under the dive safety document. I want you to keep our phone numbers in your dive bag, in your cell phone. Certainly if you're diving for an organization, they should have our information as well, but I want you to be armed so that you can get to help or help your buddy get to help with as little delay as possible. You'll hear me say this over and over again. When it comes to certain types of problems, especially that dreaded arterial gas embolism problem, time to treatment is tissue. In other words, we have a window of opportunity to crush a bubble, reoxygenate tissues, get blood flowing again before you might have die-off in some tissues. And if that's in your brain, where a gas embolism will often go, you certainly are going to want to be ready to get to us and get treated as soon as possible. You know, I've been at the helm here for about 6 years and have given this my full-time attention and passion. We have had some very serious cases. They're rare, thank goodness, but it is very gratifying when we know that we've made a difference for those patients. But prevention is still the best cure. So over and over again, you're going to hear me talk about ways to keep yourself from getting into trouble, and then how to minimize trouble if trouble does occur.